Maybe he's come.
He's come. Sadhguru was there.
Total 17 था 7K.
Yes, Sadhguru. So shall we start? Dr. Hemant will come in the next 2 minutes. Dr. Advani,
Okay.
shall we start? Yeah. Hello and welcome to Health Live at Seniors Today. We are privileged to have here today a very special session on World Cancer Day. And to help us and guide us and answer our questions, we have Dr. Suresh Advani and Dr. Hemant Tongaonkar. Dr. Tongaonkar will join us in the next few minutes. Dr. Advani needs no introduction. He is one of India's foremost doctors and oncologists in the country. He is the recipient of the Padma Bhushan and the Padma Shri, the second and third highest civilian honor awards in the country. He received the Dhanvantri and the Dr. B.C. Roy awards, as well as he was recognized with the Lifetime Achievement in Oncology by the Howard Medical International. Dr. Advani has a string of degrees, but just enough to say that he has 46 years of experience and he pioneered the bone marrow transplant for leukemia. I will also introduce Dr. Tongaonkar. Dr. Hemant Tongaonkar is the Director, Urology and Gynaecology Oncosurgery and the Head of Surgical Oncology at the Nanavati Max Hospital. He has more than 36 years of experience. He was Head Department of Surgical Oncology and Consultant Urological and Gynecological Oncologist at the PD Hinduja National Hospital from January 2012 to September 21. He was Professor and Head of Department of Surgical Oncology and Head Department of Urological and Gynecologic Oncology at the Tata Memorial Hospital from 1992 to 2012. Dr. Tongaonkar is going to be joining us, but thank you once again, Dr. Advani, for being here. It's our privilege and that you're here. Dr. Advani, I have a lot of questions that have come in, and those of you who have questions, please put them in the chat window. It's a rare honor to have Dr. Advani over here, and please put your questions down in the Q&A tab, as well as mention your age and gender, and we will try and address them to both Dr. Advani and Dr. Hemant. Dr. Advani, we have got a lot of questions that have come in, and all the people who are here are senior citizens. They are 60 plus, and they have all sorts of questions. So, can I, your opening thoughts about cancer and senior citizens? Is there something? Could you say a few words about it?
Yeah, I think this is very important. That as the age advances, the chance of getting the malignancy becomes higher. That's very well known all over the world. And the reason is very simple, because as the age advances, there are a lot of gene mutation occurring in the body. And it is these gene mutation which lead to the loss of control of the different cells in the body, and therefore they start multiplying. So I think it is very important. All of us have realized that as the age advances, the malignancy incidence also increases. Plus, there's one more thing, that there are certain malignancies which happen only in seniors. What are those malignancies? Like prostate cancer. It can never happen to a person who is 30 or 40, 50, very, very rare, but above 60, very common. At the age of 80, it almost 50% of them will have the prostate cancer. And therefore, Japanese, they live longer. All people in Japan, they live 80 years and 90 years. There, the incidence of prostate cancer and some of the other cancer is highest. So I think it is the number of the cancers become more as the age advances, and also certain cancers are more common. Why it happens? I told you about gene mutation. And why does the gene mutation occurs? During our developments from the childhood to the adult and the, I call it young seniors. So there is always constant exposure to the mutational stimulation, which means that all of us are exposed to the carcinogenic factors. And these carcinogenic factors bring about mutation. Once the mutation occurs, it takes many years to develop the cancer. And therefore, the reason for the cancer being high in seniors is because of the fact that during their lifetime, they have been exposed to the carcinogenic agents. Not only that, but we believe that the cancer is a lifestyle disease. What is the meaning of lifestyle? Everybody goes on saying, what is this lifestyle? Lifestyle is nothing but what are our habits? Where do we live? What do we eat? Three things, lifestyle. If you eat more westernized diet, like young people today are eating all the junk food, you will have definitely in future higher incidence of the cancer. Similarly, if you start smoking at the age of 20, 30, 40s, that does not cause any problem before the 50 or 60. The smoking leads to the lung cancer. When? After 30, 40 years. So you can imagine that why lung cancer is so common after the age of 60. The reason is because these are the people who are exposed to the tobacco. And we all know that tobacco is the most important cause of the cancer. Similarly, on tobacco chewing, you see all the people, they come after the age of 60, 70, tumor in the mouth, tumor in the tongue, tumor in the voice box, and also esophageal cancer. Esophageal cancer occurs because people swallow the tobacco inside, and therefore the esophageal cancer is very common. If any one of you have gone to the northeast, Guwahati, Shillong, and all those places, there you will find that everybody from the age of 10 is taking tobacco in a sopari. Whenever you go to somebody's home, they will offer you the sopari as a first time, whatever they give. And that leads to the highest incidence of esophageal cancer in Northeast. World most highest incidence is in the Northeast, particularly about the age of 60s, 70s, and 80s. So I think you can see that the number of the incidence and the type of the cancer really varies from the age to age. There are certain tumors which happen only in children. Those cancers do not happen in senior, and therefore they have their own way of developing the type of the cancers, mainly because of the end result of the lifestyle wrongs that have been done or damage inflicted to our body, which ultimately produces its expression after the age of 60s and 70s.
Thank you, Doctor. Obviously, some of the things that you have said is not happy news, but at the same time, it's important to know where things are. And, Doctor, you mentioned about mutation. Now, this is a word that not all of us knew about very much until recently when COVID happened. And, we all had cancer was known as the big C, but now the big C has also become COVID. Now, does this mean that the mutation that you're talking about now has perhaps a double whammy because there's also going to be mutation, with the virus that is happening. And is that now more bad news for seniors?
Yeah, I think, the tumors are very smart. They start with one mutation. They respond to the treatment, but they are smart because they want to live. See, every cell wants to live in the world. So they undergo second mutation. They become resistant to the drug. You try to eliminate them. They acquire the third mutation. And when you get multiple mutation, the cells are so resistant, it's so difficult to treat them. So I think obviously we are dealing with a situation just like a virus. They want to live. Virus wants to live. The tumor also cells want to live. And there's just the question of how this mutation occurs. So normally what we do is, if we want a cure and a possible cure, we see to it that we don't give much time to the tumor to undergo mutation. So if you can eliminate the tumor in a short period of time, that's the best thing that we can do.
Right. Thank you, Doctor. Doctor, we have quite a few questions that have come in. And can I start with the question? Question?
Yes, yes.
So, you've already answered this question about the fact that cancer does become a little more common at when you are a senior. The question is, what are the most common types of cancers that happen for senior citizens that one must be careful about?
Yes, I think the commonest cancers which happen in the seniors, in the males, it is the mouth cancer, cancer of the voice box, the cancer of the lung, and cancer of the esophagus. Of course, again, there's a geographical variation. Like if you ever go to the Japan, the highest incidence is stomach cancer. They are in the seniors. And if you go to the West Bengal and Bihar and the UP and the Bangladesh, their highest incidence is the colon cancer. All these are related to the food habits. That is, ultimately, stomach cancer is the food habits. While the cancers which happen in general in India in males is related to the habits, particularly the tobacco habit and also alcohol. While in females, in the elderly senior females, we get highest incidence of breast cancer. Number one cancer in the females is the breast cancer. And again, it occurs very commonly after the age of 60. While the second common cancer, I think Dr. Hemant will probably tell you, is the uterine cervix cancer. That's also number 2 cancer in India. So you can see that these are the cancers which are common in the seniors.
Thank you, Dr. Tongaonkar, for joining us today.
Sorry, I was late. Yeah.
No, it's okay. We've pulled you away from your patients and your OPD, and we always feel very guilty about that.
No problem.
Because at the end of the day, as doctors, you need to be attending to. So, Doctor, the question that we asked Dr. Advani was about the most common types of cancer, and it is appropriate that you came in at the right time about when he was talking about cancers for women and the cancers affecting the uterus. So would you like to say something about that?
Sure. I think all gynecological cancers are more commonly seen in the elderly age group. And the commonest being the cancer of the ovary, or cancer of the uterine body, what's called cancer of the endometrium, and also cancer of the lower part of the uterus called the uterine cervix. So all these three are very common after the age of, say, 60. The most of them they present, with some kind of symptoms which are ignored by the patients. It is very important to understand that all elderly women must go for a checkup even when there are no symptoms, basically because most cancers, most gynecological cancers have no symptoms in the early stages. So the cervix cancer is common after the age of 60. It's called a second peak. It's also common at around the age of 40, 45, but also after the age of 60. And these, as well as the uterine cancers, usually present with bleeding. In women who have already attained menopause, even if they have a single episode of bleeding, it is usually because of some cancer. And ovarian cancer is what is called a whispering cancer. So that is also common. So it gives you, indications which are really small or minor symptoms, which are often ignored by the patient and the doctor, both. Some indigestion, some bloating, then constipation, urinary problems. They are very small symptoms. They are minor deviations from the normal physiology. But at the same time, if these kind of symptoms are persistent, then one must consult a doctor. So all gynecological cancers are more common after the age of 60. And whether it's cervical, uterine, or ovarian, proper tests need to be done for that. Secondly, in males, prostate cancer is something which is extremely common, and age itself is a high risk factor for prostate cancer. It is said that by the age of 80% of men will have prostate cancer. Okay, so prostate cancer is something, again, which all senior citizens need to be aware of. They need to do their annual PSA, that's a blood test, by which you can easily identify and diagnose this cancer early.
Doctor, this is a question that has come in from somebody, and it is to both of you, and I would also add a bit to it, is that, Dr. Advani, you've been practicing for 46 years. Dr. Tongaonkar, you've been practicing for 36 years. Do you see that the trend, there is an upward trend of cancer incidences now? For instance, while it is a great thing that you have fantastic cancer care facilities right now, like for instance, the Nanavati Max Cancer Care that you have, and a host of other hospitals in Mumbai and the rest of the country, but has the numbers increased? And do you attribute the lifestyle ailments that you had mentioned earlier, Dr. Advani?
Yeah, I can tell you first, before Dr. Tongaonkar says, that number is definitely increasing. In fact, I tell you that breast cancer is increasing by 2% every year. In India, this is a official data from Bombay Cancer Registry, which clearly tells us that at least in the city of Bombay, it is increasing. And so also in all the major cities like Delhi, Calcutta, Madras, everywhere the cancer is increasing. The breast cancer is increasing. So there's no doubt that the cancer is increasing, like breast cancer, but other cancers as well, because of the changes in the lifestyle. I mean, there's no question our food habits are changing. Young people are really eating all the junk food, and I'm sure the incidence of the cancer will be high in another 20, 30 years. And similarly, this exposure to our environment, which is really not good, the incidence of cancer again will increase. So I think there are a lot of things which are related to the lifestyle, which means our habits, which means our food habits, which means also our environment. All these three things put together put the pressure on our cells to develop the various cancers.
Well, I'm going to ask one question before you answer this thing. Is Dr. Tongaonkar, now, for most of our people over here who are attending, they are seniors already, and they have spent their life the way they have, and they can't obviously, change it around now. But as you answer this question, is there any major change that they can still undertake so that, the as they use a stock market word, stop loss of so that there is no further damage done?
I'm sure there are ways of doing that. I mean, obviously, if you start in the younger age, it's much better, but it's not that you can't do anything about it at this age. At least, the food habits, as Dr. Advani sir spoke about, that's very important. That, one needs to avoid, I can't say completely eliminate, but at least avoid or reduce the intake of processed food from our, there's a lot of junk food, processed food, red meat. All these are known to increase the incidence of cancer. So this can certainly be reduced at whatever age. Secondly, obesity and lack of physical exercise are also directly linked to cancer. So that is something which again can be done at this age. Good physical activity and exercise, weight reduction, avoiding obesity, these things can certainly be done. Thirdly, there are certain vaccines against, so hepatitis B and C vaccine against hepatocellular carcinomas, etc. They can be taken at that age. So there are certain things which can be done. Of course, you can't avoid stress and things like that at at all times. But certainly, I mean, to avoid stress-free situations, stress is also supposed to be an important factor in causation of cancer.
Doctor, the question which a few people have asked us just now is how genetic, how hereditary, how much does hereditary play a role in cancer? Is that something that they should be worried about? And because they've had their parents who may have passed away many years back who have had breast cancer or various forms. Is that something that they should be worried about? And is there some data on that you would have?
Yeah, I can tell you that among all the cancers, only about 2 to 5% of the cancers are really hereditary, but they are there. So if the close siblings have some type of the cancers like breast cancer, we have one gene defect which we can detect. We call it BRCA1 and 2. And if we analyze that, the presence of the BRCA1 and 2 gene defect tells us that the patient has a higher incidence of breast cancer again. So like that, even for, I suppose, for the prostate cancer, sometimes we have seen in families happening. May not be the gene, it may be the environment in which they are living. So there are definitely at least 2 to 5% of the cancer which are hereditary, and one should, when one has got that history of, family history of the various types of the cancer, we can make it out that so and so is probably has a familial gene defect, and then we analyze that and we tell them that look, you have a higher incidence of this, and how to prevent the cancer, how to diagnose the disease early. That's what will be there.
Right. Thank you, Doctor. We have a question that has come in, and before I get on to specific questions that people have sent, there is this sentiment that does cancer spread slower in the elderly? Is that something that yet you have seen, Dr. Tongaonkar?
No, I don't think that is true. I think the potential of any cancer to spread depends on other biological factors and not age. So I don't think that that's a fair statement to make.
Doctor, one of the things that is a big concern for everybody, not just senior citizens, but even younger adults and even children, is about chemotherapy. And it is such a dreaded condition that is caused by chemotherapy. Is there something, is a reaction of chemotherapy more adverse for senior citizens?
Yeah, I think this is a very important question, that how we deal with the elderly. And there's a new branch which has come up. We call it Geriatric Oncology. So it's so much different that we have to name a different name for that. And there are specialists in that. The important thing is that some of the factors are responsible for the differential side effects. Like in young children and the young adults, you find that the bone marrow is very active, very active. So even if you give the high dose chemotherapy, the bone marrow recovers very fast. So we are very bold in giving very high dose chemotherapy to the young children. But when it comes to the seniors, obviously their bone marrow is not all that strong. And therefore, when you give them the chemotherapy, the recovery period takes time and has little more complications. And therefore, I think we have to modify our doses, modify our drugs in such a way that we can get the best action without increasing the toxicity. So I think there are differences. Sometimes we have to use the lower dose in elderly, and the lower dose also very effective in them. But we are selective. We select the drugs in elderly maybe little differently as compared to what happens in the children. So all the side effects are there, but they are nowadays. We have got a lot of drugs which can prevent all these side effects. So I would say that today the side effects like nausea, vomiting is almost very rare. Nobody vomits because we have a very good anti-nausea drug. Previously, we were worried about the WBC counts, hemoglobin low, and platelet count going down. Today, we are not worried because we have a specific drugs to stimulate all these three angles of the bone marrow. So you can really see that there's a difference, and really the side effects are different. So our approach is also different in terms of dosing, in terms of selecting the drugs.
Thank you. Dr. Tongaonkar, there's a question, and this is a mention that Dr. Advani made, and this entire field of geriatric oncology that is there. Now, if a senior citizen does have fears cancer or has cancer, should one go to a specialist or should one go to a geriatric oncologist? And is it something that is there in hospitals in Mumbai?
Well, unfortunately, although geriatric medicine and geriatric oncology have been recognized as separate specialties, we don't really have too many of these in India today. And majority of times, the surgical oncologist or the medical oncologist will take all the decisions in conjunction with a geriatrician who's a geriatric physician. So that is how today geriatric oncology is being looked after in India.
Right. Thank you. Doctor, we have a few questions that have come in from people, and I'm going to take these for you. But one general question that has been asked is, what is the role of antioxidants to prevent cancer? This is asked by Rajesh Verma.
Yeah, in our society and social media, there are a lot of myths, and they sort of look at the very simple explanation. And that's why antioxidant is a very common word, which everybody uses it without understanding what is the meaning of antioxidant. And then they say they are very good. Haldi, they put it into the milk. Poor patient takes the haldi with the milk and they are terrible. So I think these are all myths and these are all useless things, they have never shown any effect. And I'm told that if haldi is an antioxidant, all right, but you will require tons of haldi to really produce the antioxidant effect. And therefore, it is not humanly possible. So I feel that this is not these are all myths, and people should try and avoid these myths.
Right. Thank you, Doctor. We have a question from Mr. K.V. Lakshminarayan. He's aged 66 and with decent health. He lost his classmate, he says, at the age of 59. And he had no vices. It was not inherited, as his parents saw him go through this last journey. What could be the cause that someone with a disciplined life also succumbs to cancer? Is this an aberration?
Yeah, there's no question on that. When we say that tobacco is the cause of the cancer in the mouth and the lung cancer, even people who are non-smokers living in a beautiful green field area, they can also get the cancer. So obviously, a single agent by itself cannot be responsible. So there are multiple factors which lead to the cancer occurrence. And therefore, even if you don't have any of these known habits and all, you can develop the cancer. Why? Because there may be some genes which we don't know also, unknown genes, which can predispose the people to the development of the cancer. So it is really not that this is not all and none phenomenon. This does not that all people who have cancer are smokers, or all people who are not with the cancer, they will, if they are non-smokers, they will not develop the cancer. So I think there are multiple factors, some known factors, some unknown factors, which lead to the development of the cancer. So it's not surprising.
Doctor, is there a gene check that you should be doing? You mentioned about the breast cancer genes that are there. Is there something that people should do? Perhaps their children should do. Those whose parents have had cancer.
No. I don't recommend that at all, because huge thing that you have to do it, not worth it, because the gene associated hereditary cancers are rare. Remember, only 2% of the cancers. So if you use your modern technology for that, I mean, it will be really not worth it. So nobody recommends the gene analysis for a normal person. But we do that for the people who have suffered from the cancer, like mother has a breast cancer. If I do the BRCA1 and 2, and if she shows the mutation, then I will analyze all their children and siblings and to see whether they are predisposed to that or not.
Doctor, there's a question from a friend, Mr. Yatindra Pal, who asks, what are the side effects of osimertinib? OSIMERITINIB. I don't get the pronunciation right.
Yeah, this is the drug, osimertinib. This is a drug which is used for the lung cancer. And in the lung cancer, whenever it is diagnosed, we analyze the tumor tissue for a gene. We call it EGFR gene. And that, if it comes positive, then we use this tablet, osimertinib. It's very effective. So, 20 years ago, I could not believe that we will be treating lung cancer with the tablets. And today it is a real fact that I can treat lung cancer with EGFR mutation with the tablets. The disease disappears and it can remain normal for many, many years, which is also was difficult in the olden days. So you can see that the science is really progressing very fast and giving us this new simple treatment for the patient. Now, this drug, of course, is very effective, but it's not without side effects. It has got some side effects, but they are all tolerable. They have some skin rash, mouth sore, little diarrhea, little pimples, and some small pimples on the chest and the back. But they are all tolerable. They are all manageable. So therefore, we are never worried about that.
Thank you. Doctor, we have a question from Preeti Parekh, who asks, what prevention can we take to help a senior citizen patient age 73 who has multiple myeloma which has been detected recently?
Can you repeat the question?
What prevention can we take to help a senior citizen patient age 73 who has multiple myeloma which has been detected recently?
Yeah, you see now multiple myeloma is the plasma cell disorder, which is happens with the bone affection, and the bone marrow also is affected. Today, multiple myeloma has changed. 30 years ago, these people used to live only for 6 months and a year. Today, they are living 15 and 20 years. So you can see what a dramatic change that has happened. And this has happened because today we have not chemotherapy, but we call it biological therapy, which is very simple, easy, with no side effects, and is given over a period of time. And people recover completely. They live a very long life with the disease under control. So and we have multiple type of the treatment. And if the patient relapses, we have again the second line treatment. And after 5 years, again, if he relapses, we have a third line treatment. So we have no end to the various lines of the treatment. And therefore, people can go on living as long as it's like nowadays, I feel that it has become like blood pressure and diabetes, where you go on living with the disease with the help of some treatment. Same way in multiple myeloma, you can go on living, but with the help of drugs off and on.
Thank you, Doctor. Dr. Tongaonkar, there's a question that has come in and I would like to ask you. This is from Sanjay Trasi. And his question is, how does one prevent prostate cancer from happening?
Well, we can't really prevent prostate cancer from happening, but we can certainly try and detect it early. And first, I think you must know whether you have any first degree relative who has had prostate cancer in the past, father, uncle, cousin. So if there is a positive family history, then the checkup for prostate cancer should start earlier, maybe from the age of 50. But otherwise, maybe at 55 or 60, one should start the checkup for prostate cancer. And as I said earlier, there is a blood test called PSA, or prostatic specific antigen, that needs to be done once a year. And if that is high, then there is a chance that the patient may be having prostate cancer. And then appropriate investigations, biopsies, etc. need to be done. But basically, if you start and keep on monitoring your PSA annually, the moment you find a rise, you should investigate this patient. That way, you will detect this cancer early. But there is otherwise no preventive aspect as such. There are general preventive aspects of cancer which I told you about. Those have to be taken.
Is there, there's a normal range that is given for the PSA. If the is there an alarm bell to be rung only if it exceeds the normal range, or is it even if in the normal range, if it's on the higher side, one should be worried about?
No, the PSA basically one single value is not really. Sometimes the PSA can be raised because of some infection. So you need to check the PSA at least twice. Maybe if it's raised, then maybe after a couple of weeks test it again, see whether it is still raised. And if it is raised, now the normal value also varies according to the age. If the cutoff is normal cutoff is taken as 4 nanogram per ml, but for a patient who's just 50, it may be just 2.5 nanogram per ml. Okay, so that is one aspect. And sometimes you can get prostate cancer even with a low PSA, and these are usually aggressive cancers. So it is not just the PSA, but examination by a urologist and doing a rectal examination for the prostate, that also is equally important. So it's a combination of both, which will go a long way in detecting this cancer early.
Doctor, we have a question from Shomi Nanavati, who asks, Is there any alternative to chemotherapy for stage 4 patients aged 75 plus?
Well, the treatment, we have limited treatments. We have a chemotherapy, we have a surgery, we have a radiation therapy, and we have immunotherapy, and we have a targeted therapy. So all these are the 5-6 modes of the treatment. And obviously, among all these things, whenever we are treating, what is our aim? Our aim is to cure the disease whenever possible. And if not possible to cure the disease, then give the good quality life to the patient as long as possible. And with this aim, we really make the appropriate treatment for a particular patient. Curative treatment, you will never leave anything unturned. Because you are able to achieve cure, you will give them the best of the treatment. But when it is not curative treatment, we constantly sort of, in our mind, we think about the side effects. And therefore, in such a situation, we always like that chemotherapy can be eliminated. Or sometimes it's not chemotherapy to be eliminated, it is the side effects to be minimized. Then what you do is a secondary, whether you give chemotherapy or other treatment. As long as there are no side effects, patients are not usually afraid of. So I think in our mind, we are always very much aware about the quality of life that all of us want to live in the senior age group. And we sort of impress quite a lot on the quality of life and adjust the treatment accordingly. We know that some of the treatment can be equally good. Like I'm sure Dr. Tongaonkar will tell you that in prostate cancer, localized disease, you can either do the surgery or radiotherapy. Now, which one is better? That is what you have to advise to the patient with less of side effects. So that's how we do that. Of course, for all the chemotherapy, that it will be replaced by non-chemotherapy, not possible. But because we are able to select the chemotherapy, select the right doses, we are able to prevent the side effects. And at the same time, give a good quality and good time to the patient.
Doctor, we have a question from Balveer Lodha, who says this is for the therapy of a 68-year-old lady, whether Cryoxana Riboclib tablet is a substitute for chemotherapy in breast cancer.
Yeah, I think breast cancer, the treatment that has developed over a period of time consists of, again, as I told you, it could be chemotherapy, it could be hormone therapy, and it could be the immunotherapy as well, and the targeted therapy. So you can see that we have so many treatment options. So when we diagnose the breast cancer, it is not a single disease. Sometimes the breast cancer is associated with a receptor. We call it estrogen receptor and progesterone receptor. They require the tablets, like this ribociclib, which you mentioned. That's absolutely very, very good. It's better than chemotherapy. So we use that treatment. So hormone therapy is one of the most important treatment for the breast cancer. And we certainly use it. Not only this drug, but there are many drugs. There are 6 or 7 drugs, which are oral tablets, very easy, zero side effect. And it's a best alternative for that group of the patient.
Dr. Tongaonkar, there's a question that is coming from Jankna Modi, whose question is stomach cancer curable for a senior citizen male age 73?
Well, certainly. I mean, stomach cancer in a senior citizen with a reasonable good general condition to be able to take the normal treatment, whether it's surgery or surgery plus chemotherapy, it is curable, provided it is diagnosed in an early stage. some early stomach cancers are curable with surgery and chemotherapy. But advanced stomach cancer obviously is not curable irrespective of the age.
Dr. Tongaonkar, there's a question from Harsha Shevli who says, my mother is 64. She's had breast cancer, operated in September, had mastectomy, and has taken 4 big chemos. Further 12 small are lined up. She recently suffered from COVID and her RT-PCR is positive since 40 days. So her chemo has stopped. How much time is ideal for a break between the big and small chemos, especially in a case where somebody has had COVID?
I think Dr. Advani sir will be a better position to answer this.
Yeah, I can tell you that what is our protocol is very clear now. Normally, after 8 to 15 days after suffering from COVID, the virus is incapable of transferring or transmitting to the others. Even to the patient's body, it does not give any trouble. So normally after 2 weeks of suffering from the COVID, we are ready to start the chemotherapy. And there's no harm in that. So people are even operating after that. So I don't think there's a really any, and this 12 weeks low dose chemotherapy absolutely can go on without any problem, even if the COVID test is positive.
Thank you. There's a question from Katie Dadanchi who says, I'm 70. I want to know if doing regular mammogram after 70 is safe, as we hear radiation is bad for us at our age.
Dr. Tongaonkar?
Yeah, sure. I think mammography can, repeated mammography does give rise to an increased exposure to radiation. So one needs to be, careful while advising mammography. But I think a mammography at after menopause is what is recommended, and that can be done once in 2 years, and that is pretty safe.
Right. Thank you. We have a question from Mr. Mukesh Tiwari who asks, is colon cancer curable? And for seniors, can you throw some light on colon cancer treatment?
Sure. I think colon cancer again is a very highly curable cancer. Okay, and it is usually operable, and sometimes if it's what you call a locally advanced, a little advanced, then it requires chemotherapy in addition. But yes, the cure rates with colon cancer are exceedingly high, and even in some colon cancers which have gone to the liver, that's called a stage 4 disease, those can be cured with surgery of the colon and surgery for the liver nodules. So it is possible to cure colon cancer, yes.
Right. Thank you. We have a question from Vani Valencia who says, my father, 75, survived COVID and an angioplasty recently in the last 6 months. Later, in a couple of months, he was diagnosed with acute blood cancer, currently undergoing targeted therapy. Can this cancer occur within a short time? And was it something like an underlying problem which was not detected earlier? How do we help him overcome depression and overcome the slow way to recovery? Dr. Advani, would you like to take this?
Can you repeat it?
Yeah, so this is a question from Vani Valentina who says, my father's 75, survived COVID and an angioplasty recently in the last 6 months. Later, in a couple of months, he was diagnosed with acute blood cancer, currently undergoing targeted therapy. Can this cancer occur within a short time? And was it something like an underlying problem which was not detected earlier?
Yeah, I think there's no question that some of these diseases like acute leukemias, acute myeloid leukemia, as well as some of lymphomas, they can really come up within a short period. And therefore, you need not have that. But the diseases like breast cancer, disease like liver cancer, and the lung cancer, they don't come in a short period. They take their time. And even the prostate cancer. But blood cancers, acute leukemias, as well as the lymphomas, they come at a very quick quickly within 15 days, and within one month they can develop right from zero to the full-fledged disease.
Doctor, this is a question from an anonymous attendee who says a stage 4 breast cancer woman of 70 years old, patient is on tablet ribociclib, injection fluorescent, denosumab, and now spread to bones. How long can the patient survive?
Yeah, I think this is again the hormone therapy for the receptors positive
Sorry.
breast cancer, and with this hormone therapy can go on and on and on. We have got the patients with hormone therapy going on for 8 to 10 years, and even if the one drug like ribociclib stop functioning, we have a next line of the treatment, which again can give you another few years. So ribociclib along with the full version is very good. When it gets resistant, then we use the lipalicib tablets, which is there's one gene which gets mutated, and for that gene also we have a tablet, and that again gives you another few years. So like that, we have a lot of drugs, particularly hormone therapies, which can keep the patient going in hormone positive breast cancer.
Dr. Tongaonkar, can I ask you this question? My grandmother, this is someone by the name of Shah. My grandmother, 87-year-old, is suffering from sarcoma. She has had high-grade sarcoma in the left breast, and mastectomy was done on the left. Right now, it's spread all over and has become very painful. We want some pain management help and improve the quality of daily life. She's completely bedridden and has stopped eating food.
I think we do have pain management specialists, especially cancer pain management specialists, who are available in big hospitals. And most of these hospitals also have a home care service. So you should contact the pain specialist, and so they have something called a pain ladder. So depending on what is the severity, the appropriate drugs can be used.
No, Dr. Tongaonkar, we've come to around 5:50, and there are just so many questions that are there that people have. And obviously we've seen, and we've had Dr. Nagarajan, who was there a few weeks back on this on the Health Life show. There are just so many questions that people have, and how do medical facilities such as the Nanavati Max and doctors like yourself, address queries like these? How do people get these queries addressed from and get really good advice? Because clearly some of these questions are very basic questions. Some of the questions are fairly, of course, advanced. Is there a way in which these can be done, and we can perhaps help facilitate it?
Sure. I think one way is by doing what is called a telephonic or teleconsultation. But even that, if for these questions like this, even that is not necessary. I think we can have a platform where all these questions can be put together and maybe sent to us, and we will answer them individually. So all these queries can certainly be answered like that. So we definitely can create a platform like this on which we can address these things. I think it will be very important to do, because this awareness is what is most important.
Absolutely, doctor, because, as we have seen, and, Dr. Advani and you have answered all the questions so painstakingly, but there are just so many questions, and it really upsets me that I'm not able to ask all those questions. And, and each of them is very important. But I'm going to ask one question here. One is by Mr. B.S. Nagashetty. He said, my brother was a strong person who never used tobacco in any form and very health conscious. No alcoholic drink. Even then he developed esophageal cancer and died within a year. What could be the possible reason? There was another question like this which had come earlier. Dr. Tongaonkar, would you answer?
Sure. I think tobacco, alcohol, etc. are what you call predisposing causes for esophageal cancer, oral cancer, stomach cancer, etc. But at the same time, the risk of cancer is higher in smokers, in those who consume alcoholic drinks, but it is not altogether zero in patients who don't have these habits. There are other causes of cancer also, and even for a person who is a complete teetotaler, you can still get these cancers. It's like risk of jumping from the second floor. 10 people jump, 8 may die, 2 may not die. So it's like that, There's some people say, my grandfather has been smoking all my life and he still didn't get cancer. And so person didn't ever have tobacco and he got cancer. So it's like that, It's the probability of cancer developing in smokers and drinkers is much higher than non-smokers and non-drinkers. But at the same time, not smoking or drinking doesn't eliminate the risk of cancer.
Thank you. Dr. Advani, there is a person who had asked you about the gap between the small chemos and the large chemos. She has come back with something more. She says, in continuation to my previous question regarding waiting for RT-PCR to be negative, her hemoglobin is 6.7 and the CRP is 117 and platelets are 68,000. Is it still advisable to go ahead with the small chemos?
Not at all. Normally, whenever any form, whether the high dose or small dose, if there's so much of compromisation of the bone marrow that the hemoglobin is low and the platelets are low, we are always very careful. I would not really advise to start the chemotherapy with such a low platelet, particularly platelet count. And hemoglobin, you can always improve with a blood transfusion, but the platelet count is a difficult. And after the chemotherapy, it can go down further and resulting in the lot more problems. And therefore, I think we will, in such a situation, I would certainly avoid the chemotherapy and delay it. It doesn't matter.
Right. Dr. Advani and Dr. Tongaonkar, I'm going to ask you one last question. And this is a question that has come in, and I'm going to base ask you the question beyond this. There's a person by the name of Jairam Nanda, who's 67 and who's had myeloma and on remission, but the maintenance tablet has unbearable side effects, vomiting and no taste, cannot eat food. He's asking for which is the best doctor or hospital in Mangalore. And my question to both of you is that, and obviously we're talking about Mangalore, which is not really a small village or a small town. It's a large city, has airports and fairly prosperous. What is the availability of, while we'll answer his question, I would request you to answer his question, but what is the availability of cancer care across the country now? I still remember, Dr. Advani, that we used to have long queues outside Tata Memorial Hospital once upon a time. You would be both remembering that. But now, of course, thanks to hospitals like Nanavati Max and various others, that has spread out even in cities like Mumbai. So, what is your view about cancer care availability across the country?
Yeah, I think that's a very important point. And we have seen real transformation. When I started my practice, probably we were 2 medical oncologists. Today, there are more than 2,000 medical oncologists. So many oncosurgeons, so many radiation experts. Not only that, it's not only human resource which is more available, but also the physical infrastructure has improved remarkably, both in the government setup as well as the non-governmental organization. So I think it has been a real transformation. Government is doing their best to really improve the situation and make the treatment available to each and every one of the people who fall sick with a cancer. And the non-governmental organization, different private hospitals are also bringing in the highest technology to the country so that patient can really be taken care of in India rather than traveling abroad. And I must remember the days when almost 20 to 30% of our patients were going abroad to take the treatment. Today is a reverse. Many patients are coming from abroad to us for the treatment. So you can see what a transformation we have seen.
Right. Thank you, doctor. And Dr. Tongaonkar, what does our friend in Mangalore do? Would you be able to advise what he should be doing?
I think, see, myeloma is treated mainly by medical oncologists. So I think Dr. Advani should be able to tell us who to contact in Bangalore.
Yes. Yeah, no, as I told you, that everywhere, it's not only in Bombay. Remember, the whole country, there has been an explosion of the hospitals, both again at the government level as well as a non-government organization. So I'm sure in Bangalore, there are multiple hospitals. So whoever wants to know, he should go over there and find out nearby good hospital where he can take the treatment. And I'm sure our friends are there almost in every hospital. So don't worry about it. Bangalore is a big place and you will be able to find the real suitable person to treat multiple myeloma.
Thank you once again, Dr. Advani and Dr. Tongaonkar, for being here and addressing all the questions that are there. Thank you very much to both of you for spending quality time here, and thank you to the team at Nanavati Max Hospital for facilitating this. Thank you very much.
Thank you very much. It was a pleasure for us to be here.